a condition when an organ pushes through a weak spot in surrounding area. The major symptom is the bulging of the affected area, usually occurs in the abdomen. Symptoms. Most common symptom is bulging of affected area. Other symptoms are pain or discomfort in the affected area, weakness, pressure, or feeling heaviness. Causes. Common types of hernia are inguinal, incisional, femoral, umbilical, and hiatal. Hernia is caused due to pressure and an opening or weakened muscle or fascia. Diagnosis. Diagnosis include physical examination or imaging tests. Highlights. Treatable by a medical professional. Diagnosed by medical professional. Requires lab test or imaging. Can last several days or weeks. Family history may increase likelihood. Urgent medical attention recommended. Medications. Antacids, to prevent discomfort due to excess of gas in the abdomen. Proton pump inhibitors, reduces the acidity and discomfort.